Hello. Welcome to another post from Dr. Blake's Healing Soul. Today, Aphrodite, our athletic trainer here at St. Francis Hospital, will talk about differentiating various causes of pain in the big toe joint.
So a lot of times we have patients that come in complaining of bunion pain, but what we want to do is differentiate between the actual pain coming from the bunion, or if it's a combination of the bunion with something else like hallux limitus, hallux rigidus, if it's something entirely different like sesamoiditis. So the ways to kind of differentiate is when you have a bunion or hallux valgus, you will want to make sure that you assess the range of motion of the patient. So with hallux valgus, the patient will actually not really have a limit in range. They'll be able to dorsiflex their big toe pretty far up, but the pain will actually, they'll complain that it's in the actual bump or inside the joint. And if it's hallux limitus, they will be limited in range of the big toe. So if it's less than 60 degrees of dorsiflexion of the big toe, it's indicative of hallux limitus. If it's less range, it's indicative of hallux rigidus, and that's typically lower than 20 degrees of dorsiflexion of the big toe, so it'll be more down this way. If it's sesamoiditis, they'll typically complain of pain underneath the foot here, but as far as range of motion goes, they'll be able to go pretty far up, which is the same as the hallux valgus. So when the patient comes in with bunion pain and the surgeon wants to go directly to surgery, it's important to assess the actual source of the pain to make sure it's not just coming from the bunion, but that you're also looking at whether it can be a combination of the bunion and the hallux limitus, or a combination of the bunion and hallux rigidus. So make sure that you assess the range of motion, ask them exactly where the pain is, if it's inside the joint or just the bunion, and you just want to prevent doing unnecessary surgery, because you can actually cause the patient more pain if you're not going to the source of the pain before you go the surgery route.
Great. Thank you very much.
You're welcome.